Well, hello, everyone, and thank you for joining us for our Careers in Healthcare webinar. And today we are lucky enough to be talking to a respiratory therapist. So we want to thank Brittany for joining us today. Thank you so much.
Thank you for having me.
And we also want to thank the Ohio College Tech Prep organization for helping us with sponsoring these videos and getting them out to as many students as possible. So I'm Cassie Barlow, and I'm the president of the Strategic Ohio Council for Higher Education. And I just want to welcome everyone. Thank you for joining us today. So let's go ahead and dive in. I mentioned already that we're talking to Brittany Roberts today. She is a respiratory therapist, and she works for the Miami Valley Hospital in Dayton, or otherwise Premier Health. So thank you again, Brittany, for being with us today. And let's go ahead and dive right in. Tell us a little bit about a respiratory therapist. What does a respiratory therapist do? And how does that relate to Premier Health's success?
Sure. So our respiratory therapists at Premier, we are primarily at the bedside with our patients. We take care of patients everywhere in the hospital, from the medical surgical units, just kind of your basic inpatient stays, to the emergency room. Our primary focus, and where you'll see us most, is in those critical care areas, those intensive care units. We also do lung studies, or pulmonary function tests, as we call them. So they're outpatient tests and procedures to really see how people's lungs are functioning. So you'll see us in those outpatient aspects as well.
Fantastic. So you're primarily helping patients with their lung capacity, whether testing that capacity or building that capacity, rehabilitating that capacity. That's the primary function. And it sounds like that's an absolute critical function for patients in their recovery process.
Yes, absolutely. We help everything from patients regaining the majority of their life outside of the hospital with those rehab aspects, all the way to the most serious of situations, the cardiac arrest, the trauma responses. So we help in all facets, and we're always at the bedside working with the rest of the team, with the doctors and the nurses, to try to help our patients.
Fantastic. Thank you. It sounds like a busy day. And speaking of busy days, so Brittany gets to the hospital in the morning or whenever your shift is, and get your cup of coffee or your Diet Coke or whatever. And then what? What happens after that?
So we will start with report. We meet with our previous shift for about a half hour, go over the patients that we're going to be taking care of, go over their medications and therapies that we need to deliver. Then we will go out and we'll see our patients. We do scheduled medication and therapy times. So we'll go out and we'll round with our patients. We'll see how they're doing. From there, we'll look through the charts. We'll speak with the physicians and the rest of the care team to kind of update our plan of care. And that's pretty much what a typical day looks like for us. We'll see these patients 3 to 4 times a day, more if they need us, but 3 to 4 times a day through our shift.
Sounds like a busy day. And that's a 12-hour shift typically?
Typically, yes, 12-hour shift.
Okay. Now, if you're a respiratory therapist working potentially in an outpatient or like in a doctor's office, difference would primarily be hours worked?
Yes.
Okay.
Any of our rehab settings, whether it's pulmonary rehab or those doctor's offices where we're doing those lung tests, are going to be more of your business hours, your 9 to 5.
Okay.
Benefit there is no weekends, no holidays for a lot of people, but you are working 5 days a week, whereas primarily inpatient, one of our benefits is we only have to work 3/12. So I work fewer days of the year than I am off. So that is kind of nice.
Very nice. Very nice. Thanks for that. Thanks for that description. So how long have you been working for Premier, and how long in the industry? So how long have you been a respiratory therapist?
So I have been a respiratory therapist for 9 years. I graduated in 2013. I worked a little bit for another company for Kettering Health, and then I went over to Premier, and I've been at Premier for 7 years.
Okay, fantastic. So you've been in the business for a little while. You've had some good experiences.
Yes.
So what is that thing that gets Brittany out of bed every morning and it motivates you to get to work? What is that thing that you really love about your job?
I obviously, with any healthcare profession, my main goal is to help people breathe. Um, when you see a patient who is struggling to breathe, who's in an asthma exacerbation or COPD exacerbation, can't breathe, you step in and you administer medication and you watch that patient relax as they start to come back from that brink of, oh my gosh, what's happening? I can't breathe. Am I going to make it? That is obviously hugely rewarding. Additionally, I enjoy working at Miami Valley because I do enjoy the adrenaline. We are a level 1 trauma center. We have several intensive care units, and I am a little bit of an adrenaline junkie in that way. So I enjoy getting to go to all those trauma responses and help in those moments as well. And I work with a great team. I enjoy my coworkers. We work well together. You spend a lot of time together, particularly during COVID. We've spent a lot of uncertain times, very stressful times together. So you really do form a bond with your coworkers, and it's great to have.
Yeah, great opportunity to build team through times like that.
Yes.
So what are your, what are your hours a day or percentage of the day where you're meeting in a group or with a small team compared to you're out on your own taking care of patients?
I would estimate maybe 40% of the time when I see my patients and seeing them by myself, doing those therapies, administering the medications, and taking care of the ventilators by myself. However, you are part of that care team. So you are in communication with your nurses and with your physician. So I do have the autonomy to know what changes need to be made and to do the therapies, but I am in close communication with the rest of the care team to make sure that we all have the same goal.
Awesome. And make sure you're communicating with each other to take the best care of the patient.
Yes.
Awesome. So what's one of the biggest challenges in your position?
Well, obviously, in light of the past couple of years, the pandemic has been challenging on all of healthcare. We are no exception. The one sort of unique aspect of COVID is that it really brought to light what is a respiratory therapist and what do we do. Most people, when I would tell them that I was a respiratory therapist, would say, what is that? Is that a lung nurse? And then you get the opportunity to explain it. After the pandemic, most everyone has understood what we've done. And so there's been a piqued interest, I think, in the respiratory field. So that has been very unique. Our local colleges are, I do believe that we're back onto a wait list to get into the respiratory program, which is wonderful that there's so much interest in it. And I think that has a large part to do with that.
Absolutely. Well, maybe that's one good thing that's come out of the pandemic, right?
Yes.
More interest. All right. So sounds like your work environment is primarily in the hallways of the hospital and walking the floors and getting room to room. So yeah. How many steps a day?
My particular job role, I am one of the shift supervisors, so I am all over that hospital, and it's a large hospital. So I at least get my 10,000 steps a day in. Absolutely.
Wow. And you know all the shortcuts too.
You know the shortcuts, yes.
Yes. That's fun.
Yes.
I'm sure people are like, where are you going?
All we work in a climate controlled atmosphere, so I do very much enjoy that and appreciate that. I don't have to work outside. So I do like that.
Yes, that's a very good point. Very good point. So it sounds like your 312s don't include call, or do you have a call option as well?
Most roles in the respiratory community do not have an on-call option. There are certain job functions. For myself, being a supervisor, we are on call. And again, that's just specific to my hospital. But most facilities don't do an on-call option. There is usually opportunity for overtime if somebody's interested in making some extra money. But no, most places don't have on-call.
Okay. Okay. Good to know.
Yeah.
And so talk to me about how you became a respiratory therapist. What was that education required and potentially that experience required before your first position?
Sure. So I have my associate's degree from Kettering College. There are several programs in the area that have associate's degrees. And additionally, Kettering has a bachelor's degree. So you can get either. We had to complete so many hours of clinical time in the hospital with a respiratory therapist in order to graduate, to meet our certifications and graduate. I was able to do all of that within the 2 years, and the schedule was all laid out for me. After I graduated, and again, I graduated 9 years ago, so I had more board exams to take. I took 3. That number has since been reduced, and they've kind of combined that to make it a bit easier for us, just as the role has evolved and they've added new credentials. So now they're kind of going back and compacting some of them. So I believe they take 2 now.
Okay.
And I was
Okay.
able to right after.
Fantastic. Fantastic. So you can jump right into the workforce, it sounds like, post your training.
Yes.
So let's just say that you have the opportunity to bring a new person into the respiratory therapist department. What kind of education does that candidate need?
So the minimum for a registered respiratory therapist would be an associate's degree.
Okay.
And come with the bachelor's degree in respiratory care as well. One of the really helpful things that a lot of our student respiratory therapists are doing is they're getting a limited permit. So it's a student respiratory therapist license that allows them, after their first year of schooling, that allows them to start working in the hospital, doing some of the more basic things that we do, handling our breathing treatments, things like that. And then that way they get their feet wet with that care, learning how to time manage your patients, things like that. And they come with a lot of great experience from doing that and taking those opportunities.
That's great. That is great. Good hint. That's good to know.
Yes, it's wonderful.
And what skill would you want what is the most important skill from your perspective for that student, that new employee to have?
Eagerness. I love when a new employee or a student is eager to learn, when they're excited about it. I actually teach clinicals for one of our local colleges, and when our students come in, they're excited. They're excited to see every opportunity that they can to get to experience all of these different and unique experiences that we offer. So just that eagerness and the willingness to learn is wonderful to see in a new employee.
Awesome. So eagerness and willingness to learn. Love it. Love it. So let's say you have an opportunity to talk to a young person that is discerning their career choice and they're interested in respiratory therapy. What would you say to them to kind of push them over the edge to jump into respiratory therapy?
Yes, I tell them that I do genuinely love what I get to do. Of course, it can be stressful. Of course, there are times when you would rather be at home. But for me, part of having a good work-life balance is enjoying what I get to do and the people that I do it with.
Mhm.
And I really encourage people to talk to respiratory therapists, see how they like it. They can do a job shadow with the respiratory therapist just to get an idea of what our day is like. We are similar to nursing, but we don't do all of the same things that nursing does. We are primarily medically based. So I have a more narrow field of focus and a more narrow set of expertise on just the heart and the lungs. And I really enjoy getting to use that all of the time.
Awesome. Awesome. I love it. And now the question is, if you were talking with a teacher or a counselor who was going to talk with students, what would you tell them? What advice would you give them in terms of their advice for students?
I would tell them that respiratory is a great opportunity in the healthcare setting. Like I said, that's not exactly the same as nursing, but can have some similarities in terms of the hours worked. But it is a unique opportunity, and it's a much more driven skill set that we have. And so that's what a lot really like. And a lot of us really enjoy getting to work so heavily in those critical care aspects and being a very important member of the care team.
Absolutely. That's and like you said, a little bit of a adrenaline junkie when it comes to working at a level 1 hospital as well.
Yes.
So typical career path, then you come out of an associate's or a bachelor's degree, you start out as a basic, I'm not sure what it would be called, a basic respiratory therapist. And then you have the opportunity to grow, I'm assuming, within that. What does that career pathway look like in terms of potential for further opportunities for promotion or for additional responsibility, that sort of thing?
Sure. So when you graduate from the respiratory colleges and you take your board exams, when you come onto the hospital, you can absolutely start working right in the intensive care units, in the advanced care units, or just our more acute care units, really gathering your scope and really understanding and putting into practice all the things that you learned in school. From there are opportunities, if you go to larger hospitals, there are opportunities to work primarily in intensive care units, which is where we really shine and where we really get to use our skill set and our critical thinking skill. You can also apply to work primarily in the emergency room and be the responder for the. From there, you can work on being a shift supervisor, or sometimes we call them charge therapists, where you delegate to the rest of your team what patients you're going to see, where you're going to work. That has its own very unique skill set and very unique challenges and opportunities to help guide other respiratory therapists and say, I really see that you shine in this area and I really want to see you work here more. You do education, which is one of the pathways that I'm on now, is doing the instructing for our respiratory care students who are coming through the hospital doing their clinical rotations. So I work for the college, but I am a representative of Miami Valley when I'm there. And then you can work in management. You can work your way up into management and things like that as well.
Okay, so it sounds like you've got a lot of options, a lot of opportunity in your career.
Opportunity, I think, than what everyone realizes. So it's wonderful to see that.
That's great. So what are the typical starting wages? So if I'm a brand new associate's degree holding certified respiratory therapist compared to bachelor's degree, what are those starting wages typically?
So the starting wages for our graduates, our registered respiratory therapists, have actually been increased throughout COVID, which is great to see as well. It's been quite wonderful. Mm-hmm. Those are going to be in the Dayton area, the mid to upper 20s. I believe one of the networks is starting $50 an hour, which is great to see, especially, given an associate's degree. It really is a good living that you can get off of that degree.
Mm-hmm. Yeah, it really sounds like it. And lots of growth opportunity once you get in there as well.
Yes, growth opportunity for overtime. and extra, extra incentives that they give us to work overtime too. So that's nice.
Very, very good. Very good. So, Brittany, what did I forget to ask you? What did I not ask you that you want to tell us about what you do and about your career?
I think we really covered everything. Just like I said, the excitement that you can have working in that field where you're always a part of those response teams, those, code blue situations, the trauma responses, we really do enjoy getting to go to those, and we really do enjoy being part of that care team, an integral part of that care team, which isn't always shown when you see things like Hollywood and TV shows and so on. They tend to kind of forget about respiratory. It's not all Grey's Anatomy where it's just the surgeons getting patients up to walk. You have a whole care team there participating.
Mm-hmm. Mm-hmm.
So being able to shed light on all of the different aspects of healthcare you can go into is really great.
Well, fantastic. And I want to thank you for what you do, because the work that you do and the team that you work on is critical in our community and in our society in general. So thank you for everything that you do.
Thank you so much. Thank you for giving me the opportunity to talk about this. I really appreciate it.
Our pleasure. Well, thanks for joining us today. We really appreciate it. And I want to shout out again to the Ohio College Tech Prep organization for helping us to put on all of these great webinars for our students and teachers.